So today we'll be talking about the PCOS, polycystic ovarian syndrome. It is mainly about the reducing modifiable risks, that is weight, insulin resistance, cardiometabolic factors, and there is no confirmed method completely how to prevent it on onset. So uh, can PCOS or PCOD be prevented? If you ask, then I'd say PCOS is a multifactorial, at least genetic disorder with a strong links to insulin resistant and obesity. Current data don't support the guaranteed way to stop it from ever developing, but several measures, that is low risk, blunt, or blunt is expression in predisposed women's. Okay, first the primary prevention focus is the weight and adiposity. Weight and adiposity, the insulin resistance uh, present in present 65 to 80% of women with PCOS and is worsened by excess weight. So insulin resistance is there and excess weight is there. One more thing, like this obesity and central adiposity is the key modifying factors. Maintaining the normal BMI and the circumference is the most important preventive strategy. So one is the insulin resistance, second is the obesity, mainly the central obesity. So lifestyle pattern. How the lifestyle pattern is in women with or are at risk of PCOS. Lifestyle modification is the first line of management, improves the metabolic and reproductive features. Now, but how to control it means a type 2 diabetes style diet we need to continue, that is high fiber, low refined carbohydrates, saturated trans fats with more omega 3 and omega 9 fats, plus calorie control, so which reduces the insulin resistance, improves the cycles. Okay, the next thing is the moderate exercise, that is greater than or equal to 150 minutes per week with 500 to 1000 kilocalorie per day deficit. Achieving the 2 to 5% weight loss can restore the ovulatory cycles in obese women with PCOS. Similar measures in high risk likely reduces the progression towards a PCOS phenotype. So one more thing what we need to do is smoking cessation. Smoking cessation is recommended to add cardiovascular risk. Now the third thing what we need to do is vitamin D insufficiency. We need to screen about because it is very frequent. There is in PCOS patient vitamin D insufficiency will be there. Metabolic syndrome, especially with the metabolic syndrome, it will be there. One more thing is in women with mixed factors like. There is a family history, basically irregular cycles or mild hyperandrogenism. So, and hyperandrogenism. Early screening and treatment of impaired glucose tolerance dyslipidemia is advised to prevent the cardiometabolic complications. So, how we can import a concise lifestyle plan? You can follow it whenever there is a high risk of developing this polycystic ovarian syndrome. First is the weight. Okay, daily lifestyle changes में weight and activity, aim to keep the BMI in the normal range, avoid the central obesity. Even 2 to 5% of the weight loss can help to restore the ovulation in obese women with PCOS. So target more than 150 minutes or more than or greater than you can go. 150 minutes per week of moderate exercise. Weeks work 30 minutes for 5 days per week. Like that you can continue. Limit the prolonged sitting kind of thing. Limit light activity, limited prolonged sitting. You should not sit for long hours at one place. You have to be keep some light activity like stairs, short walks throughout the day. So this is the next thing is use diet plan. Diet pattern is what diet pattern you need to see. Type 2 diabetes style pattern we can continue for this PCOS also. So we have to, what you need to increase is vegetables, whole fruits, whole grains, oats, brown rice, pulses, beans, healthy fats, fish, nuts, olive, mustard, canola oil. Okay, omega 3, omega 9 we need to include. What we need to limit or avoid is sugary drinks, sweets, refined flours, white bread, pastries, deep fried food, fast foods, trans fats, excess saturated fat, fatty red meat, or and ghee. Ghee in excess you should not use. Preferred home cooked food, portion control meals, and avoid frequent snacking. Okay. Uh, in overweight, high risk women, a calorie reduced diet that is 500 to 1000 kilocalorie day deficit supports the gradual weight loss. Okay, so another thing what you need to concern about is no smoking. No smoking because PCOS is associated with high cardiovascular risk. Check the vitamin D levels periodically. Check if is deficiency are there or not, because in most of the patients with PCOS there will be deficiency, especially with metabolic syndrome. If it is there, it's unique. The second kind of thing is ask your daughter. Sorry, ask your doctor for periodic this test. Fasting glucose or 75-gram OGTT and lipids you need to see everything. Family history, obesity, irregular cycles, hirsutism. When to see your doctor again means the thing, first and foremost thing, the menstrual cycle consistently it is increased on 40 to 35 days or a very regular cycles are going on, then you need to see your doctor. Okay, new worsening facial or body hairs, acne, weight gain, uh, especially around the abdomen, difficulty in conceiving, and strong history of PCOS or diabetes, you have to see. The next thing what we need to concern about is treatment. Now, what is the treatment of it? The treatment of a polycystic ovarian disease is symptomatic goal was directed lifestyle for all tailored pharmacological therapy for cycles like hyperandrogenism, fertility, metabolic rates. Okay, lifestyle for all patients. First and foremost thing, lifestyle you need to see, because main thing is weight loss and exercise is the first line treatment for overweight, obese, insulin resistant women having PCOS. First, what you need to do: low calorie diet, type 2 diabetic diet. You can take like in which you have to increase your fibers, decrease your refined carbs and saturated trans fats, and increase the omega 3 and 9, which I have told you previously. Yeah. Second thing is, even 2 to 5% of weight loss is there. It restores the ovulation and it improves the improves the hyperandrogenism and metabolic profile. Now the next thing, menstrual irregularities and hyperandrogenism is there. Not seeking pregnancy in that kind of moments, you can start combine oral contraceptive pills are the first line of drugs for irregular cycles. Okay, what it will do means it will prefer low dose ethinyl estradiol with a non-hydrogenic progesterone. Then they will increase the serum HSBG. It decreases the free testosterone, suppresses the LH and FSH, and normalizes the bleeding and reduces the hirsutism and acne. If hirsutism is persisting more than or 6 months on this contraceptive combined oral contraceptive pills, then you need to add spironolactone and androgen with reliable contraception. Now, if the second kind of category is infertility and ovulation desiring pregnancy patients, then we have to start first line of ovulation induction is letrozole with high live births and ovulation rates, then this clomiphene. Okay, alternative or next step is also there. Clomiphene is there if letrozole is unavailable or contraindicated. Add metformin to clomiphene in older, obese, clomiphene resistant women. Okay, increases the ovulation, but not clearly like live birth organ. Second thing is low dose gonadotropins or laparoscopic ovarian gland. Yes, the third thing is you can go ahead with IVF if previous steps are failing ones, you can go ahead with that. And the third thing, if you want to metabolic rearrangements, if we see for the patients, then we have to add a metformin also for women who's having diabetic kind of thing, who's adult, uh, she's adult, having BMI more than or equal to 25, primarily to manage insulin resistance, then you have to need to add metformin. What it does means it improves the insulin resistance, androgen modesty, and supports the weight. Okay, it supports the weight loss and ovulation in many individuals. So, fertility is control reduces hedonism, acne, and then locally laser electrolysis, implementing cream or depletion, topical retinoids, antibiotics, isotretinoin. For severe acne, they can use. So for today, this much only. Again, I will get back to you in more detail kind of thing for these ways. Okay, bye bye.